In this procedure, we'll be doing an oral exam, tracheal exam, and sacculectomy on a Norwich Terrier. First, we start in the mouth and we check the tonsils. In this case, both tonsils are just a little bit out of their crypts, but in a lot of dogs that are under, this is under ketamine and Valium. The reason we use ketamine and Valium is that the dogs aren't cough, they will cough if we respond. If propofol is used, you have to give another drug to make the dogs cough. In this procedure, there will be a little movement and surgery, but it's not anything that we couldn't deal with. And what we're doing first is we're examining the soft palate. We want to see the soft palate cover the tip of the epiglottis. In this dog, the soft palate might be a little bit on the long side, but it's not bad, and we could see that the soft palate was not extending down into the larynx. In bulldogs and some of the brachycephalic breeds, we'll see that the end of the soft palate might even be irritated because it's hanging so far down into the throat. In this dog, we see some irritation and thickening in the suprapharyngeal area, and we thought for a while that that was one of our causes for possibly these everted saccules in these dogs, but it turns out we see everted saccules in dogs with a completely clear nasopharynx and in some dogs with a lot of edema in the nasopharynx. We are now going to proceed down into the trachea, and you can see the trachealis muscle move as the dog coughs. On the ketamine and Valium, the dog can cough but not move, and so this works very, very well for us for surgery. And the important part of this is, as we go in and remove these saccules, we want the dog to cough because the layers of the saccules will then come out afterwards. In like a bulldog or some of the other breeds, if you grab the saccule and remove it, the saccule's done. You don't have any more procedure to do. But in these Norwiches, for some reason, we can remove the surface of the saccule, which you'll see here in a second, and then at the next stage we have the dog cough and more saccule tissue comes out. It's extremely important in these dogs to remove all of that tissue by multiple passes with a laser. You can see after the first pass, we have spared the vocal folds on both sides, but as this dog coughs, you're seeing saccule tissue evert. And then we're going to do another pass with a laser, and usually we find out that it takes 2 to 3 and sometimes even 4 passes. We'll stimulate the dog to cough again, and then we'll see if we have new saccule tissue sticking out. We'll go in and remove the tissue that you see in the bottom right hand on the dog's right hand, your left hand on the screen. And we remove that on our last pass of the tissue, or the laser. But you can also see that some more was coming out on the side, on the dog's right side. On this pass, we see we have a pretty clean opening on the left side. We'll probably go back in on the right side and take just a little bit more out of that area, and then the surgery is complete.